Lakini karibu.
Hapa miti. Mmepanda nini?
Sisi tuna support mambo ya do away with global warming.
Okay.
Na pia tunapenda environment yetu ikika smart, ikika clean, it's good for the children who are growing. Alafu pia ni part ya creation ya Mungu.
Is there a story behind?
No, mama yetu anapenda maua sana. Na ametu influence pia sisi tunapenda mambo ya small plants kwa boma. Tuko na maua, tuko na kitchen garden, ukiangalia huko utaona ndizi. Na pande nyingine tulikuwa tumepanda machungwa na papai. Yeah, but zote tu ni benefit yetu.
Right.
Karibu Imani. Mimi naitwa Steve.
Ya pili?
Soita. Steven Soita. Nimelelewa hapa Imani.
Okay.
Nimemaliza primary school, nimemaliza high school, nikamaliza college, nikapata kazi kwingine. But sasa after some time I came back to give back to the community.
So before giving back, the first time ulikuwa hapa, ulikuja, how old were you?
I was 13 years.
And Faith Imani,
yes,
who you would refer to your mom.
Mom, yes.
Yeye ndo alikukaribisha huko?
Yeye ndiye alinipokea. Na akanilea, ameninacha yeye kwa mkono wake mwenyewe. Pia kama mama amenisaidia kugrow kimawazo during that period, because mimi nilikuwa nakaa hapa Imanie, and most of the time yeye pia alikuwa hapa kwa hii center ya Imanie. Before we got other centers, Imani B na Imani Malindi na Ngong. Na nitawaelezea zaidi juu ya hiyo. Hii ndio story ya Imani.
I know it's a whole tree, it has a number of...
Yes, it has all our centers in there.
Okay.
Generally, mtu akishatupa mtoto, unaona watu wa abandon huko kwa hospitali, kwa mabarabara, dumping sites and what have you, all those places. So when they abandon them, wanachukuliwa na Department of Children's Services na polisi. Then they are brought to Imani. Ndio unaona nasa anabeba mtoto pale. So when they are brought to Imani, they are brought to the Imani Babies Unit.
Okay.
That is the receiving area hapo. Hapo kuna 24 hours care. The youngest sasa tuko naye utamuona ako wiki 4. Ako wiki 4, anaelekea mwezi kabisa. Na from there they graduate to now Imani, this side of the facility.
Okay.
So huku wanatrainiwa mambo ya kuanza kujifundisha kusoma and doing their own small activities. Besides that, tuna host pia wale wako na chronic illnesses.
Okay.
And children who are exposed to HIV. So we still have them here. They are part of our population. Right. And we learn how to manage them. Tuko na Imani B iko Matopeni. It's 3 kilometers down from here. Wale wakisha graduate 2.5 years, tunawapeleka kule. It's established like a family unit. Right. Ni kama estate. Yeah, so they stay there. At that time, most of them are open for adoption, for foster care, because we still have their committal orders and other legal documents from the government. So they are opened up for adoption. And the others go for adoption. Others still stay with us there because our party watu wako foster ama to adopt them.
Right.
Yes, then we have Imani Malindi, which initially started as our holiday project, but we ended up taking in children that are having issues there. We could find small girls that had been married off to wazes. We rescued them from those wazes, tukawarudisha nyumbani.
Okay.
We gave them an education. Now sasa ni watu wana live independently. We also had and we still have families headed by children because of the AIDS pandemic, how it's rampant in the coastal region. Those parents died, so the family was headed by a child. So the child will not go to school because of fending for the others. Now we took them all in, accommodated them, gave them an education. They are independent people helping the community in Malindi. And it's a nice place you should visit, but still Malindi. community in Malindi. And it's a nice place you should visit. But still in Malindi, we are having an established, a home that is not established yet for the people who have living with disabilities. Yeah, tuko na home hapo. We walked from Nairobi to Malindi in 2014, 21 days, 30 kilometers a day. From Panari hapa mpaka Malindi. Tukapiga guu kabisa. We raised some 6 million. We purchased a piece of land there. And after purchasing that piece of land, we dug a borehole, tukaifence vizuri, tukapata mutation yake, but sasa tuna pesa ya kuidevelop. We're still looking for people to come in and fund that project. We have Imani Ngong. The Imani Ngong started as a home for the boys in a high school. Yeah, because watu wakifika teenagers unajua saa zingine inakuanga ni maneno. So at Imani Ngong, the boys wakagraduate, wale tulikuwa nao wakaingia college, na walipoingia college wakahamia home ya Kasarani. But Ngong ikabaki, we brought in children that were from street families. Yes.
Which age group?
By then the eldest of those children was around 4 years. Yes, we had rescued them from the street families in the social Olia in Kayole na some other parts long before ugatuzi kuje. So we brought them there and we gave them an education. Now they graduated, some went to university, others went to technical schools, and they are people of substance in our nation.
All right.
Yes, we also have Imani Kasarani. Initially, it was for girls who had graduated and they were in college and technical schools, but eventually the number has dwindled because most of the children now are exiting as they grow. So it was turned into a home for hosting the children of imprisoned parents, whose parents were incarcerated. So it's in Kasarani Santon, it's still there. We accommodate those children, and jail term ya mzazi kisha, we integrate them. Yes, we call it integration because it's a gradual process. Si kitambo venye ilikuwa ni repatriation, once the jail term ya mzazi imeisha na mtoto wanashikanishwa, you find that these people are still strangers. So we brought in other measures in between to make the process gradual. Mtoto anaenda anafanya visits kwa jela ya mama ama baba. So when akitoka jela, it's a common. They are not strangers to each other. Yes. So as you can see, the tree on this side iko na maua, iko na nice oranges. Yes, ripe fruits. So back to the community, ndio sisi and others that have graduated. Yeah, and in between also kuna wale they don't graduate in between there. Previously kuna those that have exited through adoption, others have exited through foster care, others have exited through rejoining to their immediate families, and some have died, so to speak. It's unfortunate, it's a way of life.
How many children so far? Maybe since the 32 years, since 1992. How many children roughly have gone through Imani?
We can estimate at 3,000. We can estimate at yes, me included. We can estimate at 3,000 because when we have our alumni association, we look for a bigger place where we can go because tuko wengi and we are all over the world. We thank God that it's something that is blessed us with, and currently our in-house population is 350 in all these centers.
All of them?
Yes,
right.
Yes. So besides that, and 50 children. Yes, boys and girls. And besides that, we have other programs, education program, we have a feeding program outside Imani. There are children in foster that we also support outside Imani. Yeah, more than 1,000. So you can see it's a very extensive program.
Steve, let's talk about the elephant in the room here. Before sasa uanze kunitembeza huku ndani, the government has proposed a whole plan to do away with private children's homes.
Yes.
And this is a private
Yes.
children's home.
Yes.
So how much? I mean, it has given you about 8 years,
Yes.
roughly. To put your books in order before now they actually, do away with all private and establish a public. First of all, what, as someone who has been through this, kind of program, what do you think about this?
Let's look it from a black and white perspective. From a white perspective, charitable institutions have helped so much, especially the private charitable institutions. They have helped so much in reaching out children, unfortunate children who, under one circumstance or another, didn't have anywhere to turn to. So these facilities have reached so many people. On the black side, some of these institutions that are making it bad, or that made it bad for the entire children's home to look like it's a money-making venture. Yeah, the systems and the methods they use in fundraising are somehow, let me say, orthodox or not ethical, and that tarnishes the name of the private children's homes. Also, you'll find that these other children's homes that have made the name look bad, you'll find they are channels of other things that the government raised, the concerns of trafficking and what have you. Well, this program was started way back sometimes in 2016, 2017, when the government stopped registering new homes. It cut off that, and then it only worked with serving the homes that had been registered.
Right.
Now, it also went further. It has gone further into reviewing homes that were registered and evaluating them, and also checking on the suitability for children to stay there. That is why you will hear some homes have been closed, some homes are under the watch of the government because of various factors. Right. Well, now the government has come in now. It's not registering new homes again. It's not re-registering registered homes again. Yes, according to the care plan and all those, the new government. I'm forgetting the name of the book. I'll tell you as we go. Okay. Yeah. So from those manuals, the government is only limiting the number of children in the homes. Yes, you see, committal, we have to renew committal orders. You cannot renew a committal order without a valid certificate from the government. Okay. So all those factors they've put in place, this thing, it will not just come to a sudden stop. So it will grind slowly to yes, it's a gradual process. As Imani, we had been well prepared because we did not want to be hit on the blind side, and we also moved with the government. We have sought more avenues to work with the government on adoption. That is local adoption, because the government banned international adoptions. We work on local adoptions, and also we work on, majorly, we work on foster care. We are having a pilot program for the foster care, an alternative family care. Right. Yeah, because we also believe that children live best in a family. Yes, in a family is where you find that warmth, and the parent is concerned about you and your siblings and all that. Yeah. Yes, here in institutional care, you find that you are assigned to one caregiver, you have 7, 8 children, and all those activities that happen might be difficult. Yeah. Yes, and so all these factors put in place, we see it's better to children to have a family, to stay in a family. Right. But we also want the process to be guided nicely. We want it to be guided in a proper way, so that children who are in between here, between the institution and the government, they don't suffer during the transition. Yes, we want them to exit or to transition into the next step properly. And if the government has put in all those proper measures, then it will be a good thing. It will be a good thing, yeah.
Right. So the word Imani,
yes,
even the name comes from Faith Imani. Who,
yes.
Ali was saying, well, she's your mom.
Yes,
and,
yes.
Today is Wednesday. This Friday is Mashujaa Day.
Yes.
First of all, will you call her your Mashujaa before sasa tuanze kutembea huko?
Sitamuita Mashujaa, nitamuita Shujaa.
Oh yeah, Shujaa wako. You can actually call her Shujaa.
Every time I post a photo of her on my wall, I have a small caption imeandikwa hapo bingwa. Bingwa. If not bingwa, hodari. Yeah, growing up in an African setup and her being a mother, not just a head of an institution, being a mother, that is the catch. She could be a head of an institution. She could have assigned other people just to take care of us, but she was there. She's been there and she's still there in the forefront. Yeah, now we are grown-up adults, but she still has advice for us as grown-up adults. Talk of African mothers out there, yeah. They are with you in the whole process.
So hata sahi anakuona anasema wewe ni baby boy.
Anasemanga wewe kijana wangu. Na niko na ndevu ya white bwana. Niko karibu kufika 40. Yeah, but it's a good thing, eh? And celebrating her, it's not just in terms of she's made homes here, she's seen how they grow, but the lives she's impacted as a person, not only for the children in Imani, but for other people outside Imani. Yeah, that makes her the Shujaa, the big Shujaa of the day.
And tell you what, I had talked to her, earlier kwa simu nini, telling her, we are really coming here.
And anaongeanga kwa simu sana.
Akaniambia, sawa mimi nitakuongelesha, lakini ujue Stanley, mimi kwa kamera sitaki kuonekana.
Kamera umu-intimidate.
Akasema, so definitely, you probably want to see who is this Faith Imani, but akasema, she really wants to keep, low profile, wacha, watoto wake wamuongelele. And she also told me, you'd really show me around.
Yes.
I'm looking at the whole entrance. Is there more?
Yes, there's more. Besides this house, is this Kilimanjaro house. Right. We hiked Mount Kilimanjaro to raise money for that. In 2003, nakumbuka nilikuwa form 3, tulifika pale summit ya Kilimanjaro. It's a very difficult trek. Yes, so we raised money. We built that. Ilikuwa ambao tuna ni ground floor. So we built that and we did some landscaping here. Right. And some money that remained, we purchased a piece in Ngong.
So Steve, even as we wrap it up now, yes. But I'd actually even really say Imani is definitely a big Shujaa.
Yes.
Hopefully one day atakubali tuongee naye.
Hata mimi namuombea siku moja she feels intimidated na kamera. Atakangi hata kumpiga picha. Mambo ya picha hata hapendi. Tuko na picha yake kidogo sana. But picha yake iko kwa matendo yake. Her photos are in her deeds.
And even even the name. But then even as we wrap it up, nikipata your last words on even children's homes. I mean, you're definitely talking about how kunafaa kuwa na regulation na nini, the future of this place, even for the children. You've been here, now you're back here, now giving back to them. Even for your last words.
You see, there is no day that we can solve issues that concern children. We close these homes, then other problems of consultations and advising parents on parenting and all that rise up. We still have a long way to go in making sure that children are given a good future. And how do we give them a good future? Is by influencing and showing them how to live, giving them proper values so that their character can be good when they grow up. And that is always the motto of Imani. We say, if you want to change the world, first change the thinking and the perspective of the children. then the whole world will be changed, because the children are growing into the society. Yes, Imani is big. I would want to show you around this facility. I have my sister Mary atawaexplainia about the Montessori.
So Mary nitampata huko.
Utampata hapo mbele. Yes, and this facility, when we come here, we call it nyumba iko juu ya mlima. It's a house of refuge. Yeah, because for sure it's healed a lot of wounds. It has given a lot of people peace. It has given relief to many, many, many people who did not have hope, who did not see any light, or who never had any opportunity of or any thought of progressing in future, probably.
If you were to describe this house, this home, in one word, how will you describe it?
Nitaita house of refuge.
No, one word. One word. Be creative.
Imani.
One word.
One word I can say, sina neno mzuri isipokuwa nyumba ya imani. That's
so 3 words. Yeah, nyumba ya imani.
House of peace.
House of peace. I love that.
House of peace.
I love that. Thank you, Steve.
You are welcome.
So pale mbele nipatane na Mary.
Mary pia ni mmoja wetu. She'll explain to you about her life and also things to do with why money runs and all. Na pia yeye akona maneno yake kando.
So even for the viewer to understand what to find on the other side of where we are right now.
Yes.
So what would prepare them psychologically? What should they be preparing for?
We are prepared. They should see where children are received.
Okay.
When the babies come into Imani, the first landing point they come is that babies unit. Yes.
Shukran sana.
Nafurahi.
Sawa.
Nafurahi na karibuni tena.
Sawa. Tupatane na Mary uko mbele.
Okay.
Hi Mary.
Hi Stanley, karibu.
Wewe ndio nimeambiwa nikutafuta?
Yes, karibu sana.
Hapa lazima nivae.
Hapa sababu ni kwa watoto, lazima uvae protect na germs. Hapa ni watoto wanakianga.
Right, Mary, the second name is?
Achie.
Right. Okay, before tuendelee, because Steve on the other side aliniambia on this side utapata, Mary atakutembeza all this place and atakufisha kwa Montessori. This place looks amazing, I must say.
Yeah.
Even the whole ambience, the sauti, watoto crying just on the background. But first of all, who is Mary?
Mary Achieng. I'm a former child of here. This is my home. Currently, I'm a sales engineer. Yeah, so I've walked the journey with Imani up to this point. So,
Which year was this?
I came to Imani in the 2000s, many years ago. Yeah, I was still a young girl.
How is this place like back into the early 2000s?
Yeah, quite a lot has changed. So many modern things now. Yeah, I remember those days we used to walk to school just nearby. Nowadays, all the kids are dropped and picked by the buses. So with the modern technology and everything, so much has changed, but it still feels like home. Yeah. And
I love the fact that you actually say feels like home, because right now, and I'd ask the same, I'd also ask Steve the same. The fact that you actually, say it feels like home, even 20 years from now, it will still feel like home.
Yeah.
But the difference is, maybe 20 years from now, it might not be here, because the government has proposed the whole plan to do away with private children's homes. First of all, as someone who has been here in a private children's home and has worked through the journey, right now, sales engineer, I mean, that's definitely huge. What do you have to, what's your opinion on that?
Yeah, when I heard about that, it came as a shock to me, because this is what we've known as home. This is what mom has known as home. So my plea is, like this institution, it's regulated, it has helped so many children. I wouldn't say I would be where I am today if it was not for Imani. Okay. So I have mixed feelings about it. So it's something that, for me, I'm still processing.
Right. So this Friday is Mashujaa Day. Who will be your shujaa?
My number one shujaa will be my mom, Mama Imani. The mother who took care of us from the time we were young up to today. She still prays for us. She's still so proud of us, and she's still walking the journey with us.
How would you describe her?
I describe her
Because I mean, I was also telling Steve this. We were talking on the phone and telling her that can we actually have a virtual interview with you? She was like, nah, I really want to at least Jinake tujue Faith Imani out here, but she doesn't really want her face out here. But how will you describe her, even for the viewer to get a visual of so this might be the Imani we're talking about?
I would summarize her in one word: love. Because she's loving to everybody, even down the streets, everywhere she walks. She's a loving mother. And you've seen the welcome she's done for us, just a feast. She loves to feed, she loves to nurture. So I would say, when I think of her, I think of her as love, because her love is unconditional. She doesn't look at your background, she doesn't look at your status. She will love you regardless and support you regardless. Yes.
Right. So bado in as old as you're right now anakuangalia naona bado ni baby girl.
Ni mtoto wake kabisa. She calls me at night, she prays for me. She wishes the best for me. And that really touches my heart.
And so far, I mean, you've been here, but then right now you're also managing other projects relating to Imani. Tell us about that.
Yeah, right now we have a new project. It's called Imani One Piece. It was our former home where, when we finished Form 4, that was the place the boys used to stay.
Where is it located?
It's in Ngong.
Oh, Ngong, okay.
Yes, so Ngong Ololua, next to our other project, the Ngong Resort, Imani Resort. So this is a project that came and it is a vision of Mom as well. When she saw the children that had chronic illnesses at Kenyatta Hospital, the children who've come for chemotherapy as far as from Kisii, from Marsabit. And in Nairobi, the cost of living is high, and nobody wants to accommodate people they don't know. So you find some sleeps in the corridor, some sleep on the benches outside there as the children go for treatment. So this is a home where you come with your child and you're able to go for treatment, and you have a place you can sleep with your child. In the morning, there's transport. You can take them to Kenyatta and come back. So it even reduces the chance. Some even abandon their children in Kenyatta because they see such a burden. And some you find when they go back home, they will not come back again for treatment because in Nairobi they wonder nitalala wapi. Yeah, sometimes the relative is in Kitengela at the river, hata hiyo fare hauna. So it's somewhere where we can take care of the mothers and the children.
Right.
Yeah.
And now for this project, are you partnering with KNH?
Yeah, we are partnering with KNH. We've signed an MOU. So they are supporting us in some of the things, but mostly we need donors and sponsors to step in for the daily running of the project. We need food, the upkeep every day. Yeah.
Right. And I mean, for 32 years, you have definitely, or rather, Imani has definitely not worked and continued with its whole daily routines without a sponsor here, a donor there. Tell us about that. Maybe over the years, which kind of sponsors have you had, and maybe are there, apart from KNH, are there others currently you're maybe partnering with, even maybe the county or national government? Currently,
I would say mostly we are depending on well-wishers and donors. And we have a pay bill number, 555-300, account number is donation. So mostly we depend on well-wishers, and we don't get like any specific amount from the government or something that you're sure of you're going to get. So mostly it's just dependent on well-wishers. Yeah.
And now even for example, even say some of this like this particular setup, and even the babies who are crying out here, that whole process of having them come here, you work with maybe let's say even the police, the community health, and community-based organizations. How does that work? Do people volunteer to come and work here? How does that work?
Yeah, the higher percentage of children here are those abandoned at Kenyatta Hospital and Mama Lucy. So mostly we get them through the police. Of course, it has to be a legal and a straightforward process. You cannot just go and pick a baby. So it's a straightforward process. If you want to adopt a child, Yeah, there are regulations as well. So we don't charge anything, but you have to cover for the legal fees. So that goes through the lawyer. Right. Yeah.
So with and for your last words, your parting shot, maybe the kind of future you see for Imani, looking at that camera, what will be your last words?
I would say Imani still has a lot to offer, and Mom has so much she wants to do, and we are partnering with her in this, and we're asking even for well-wishers in Kenya. I know there's so many people who have this in their heart. They want to support such a program. You can reach out to us, Imani Rehabilitation. We have a website. We are on social medias, and you can also support us on paybill 555-300, account number donation. So Imani is our home, and it will continue to be our home.
Right, asante sana Mary Ching for all those particular wise words, and hopefully if you're out there, you can definitely and always chip in and actually support these children who are here. We're taking a short break, but after this particular break, we'll be speaking to other stakeholders and people who have actually been through this program, Imani Children's Home. So stick around for that. Right, welcome back. And in case you're just joining us right now, we are at Imani Children's Homes. This is Soweto in Kayole County, rather Kayole in Nairobi County. And before the break, I was talking to Steve and also Mary, who have been here in this particular Imani Children's Home, which has been in existence for the past 32 years. And right now, I want to talk to Bazenga Moja Pevi, Daktari actually, Niajidoki. Full name, first of all.
My name is Chris Thairo. Okay. I'm a product of Imani Children's Home. I joined this home in 1994, sorry. But then I was 2 years old. So there is much that I can remember. There is so less, sorry, that I can remember. Much is what I'm told. So I went through my education system in this home from primary school, high school.
Just reminiscing and taking down memory lane. How was life back then? Maybe early 2000s wakati ulianza sasa, when you now, it's about 4 years or 6 years nini. How was life then?
It was fun. It was fun. You know, being in a home where you so many boys, you know, you have quite a number of playmates to play with. And I used to look after goats. In Imani B, you have been to Imani B?
We will definitely be tutatafuta venye tutaenda huko.
Yeah, so that used to be my core duty after school. So to me it was fun.
Did you long for the whole family kind of setup? I mean, maybe hata ukiwa na even friends around here, they tell you, hey, sisi tukiwa home, madhe anatupikia chapo, nini, you know, the kind of stories that they're telling you, and unaangalia maybe even the setup that you're in, it's institutionalized kind of setup.
Have you eaten my mother's chapo?
Oh, yes.
So I don't see any difference.
Oh, okay.
I think mom has given us the best. We have had that full experience of a family life. For example, we have a holiday home in Malindi. Maybe even you yourself, you would not say, you know, in our family we have a holiday home in Malindi. You know what I'm saying? But every time we are in school, we are in Nairobi. The school closes, we go down to Malindi for holiday. So I would say mom has brought us in the best way possible someone can bring up.
Mm-hmm. I've asked Stephen Mary the same. How would you describe Faith Imani? Maybe in one word. Steve alishindwa kutumia one word. In either 1, 2 or 3 words.
You can't condense her into words.
Just try.
Whatever I say, I still believe it will be.
How many be the yeah? How many words will you, if briefly, how will you describe her?
It's interesting because everything that I do, everything that I say, sometimes I see some elements of her in me. So I don't know how I could condense that into a few words. But what I would say is she's the only human being that I've seen who have the best interest for humanity beyond her own interest.
This Friday is Mashujaa Day. Will you say she's your Shujaa?
She has always been.
She's always been your...
Yes. She's that one person who, when I can't achieve something, and I think of what she has achieved. Actually, for your information, she built this house at the age of 19. So what were you doing at the age of 19?
Wow.
Yeah. At the age of 19, she had 32 children, feeding them from her pocket, clothing them, educating them, and providing a house for them.
Do you feel like, I mean, back then, and the fact that as much as aliniambia she's camera shy nini, akasema my sons and daughter will speak for me, her future, and you've been here, you understand her future, you know the future that Imani has. And back then, 32 years ago, Imani Children's Home had a future of, and it's, you know, kind of vision and all that. But then, the government policies, the government in the day has its own policies, how it really wants things to be done. Right now, the whole, well, not kind of new, because it has been a whole gradual thing, really scrapping of private children's home. How much of an impact will this have for such a place?
I think it will have quite some negative impact on the same. The government of Kenya, as it is, do not provide any funding to this private children's home, does not provide medical care to the children in this private children's home. For example, if a kid gets sick here, they'll go to Kenyatta and they'll pay, just like any other person. Then how do you convince me that even if they were to close down this children's home, then the following day they're gonna take responsibility of the children who came from this private children's home? For example, we have babies from day one here. You've visited, right? Who gives us these children? It's the same government of Kenya. So where do they want to take them? If they had working children's home, I presume then instead of the Kenya police bringing day one old babies in a private children's home. If they think they are not working, they should be taking them to their own children's home.
Right. I definitely even had to consider just having that, sink in.
Yeah, because they refer themselves, like I'm sure Steve took you through the process, how a baby gets admitted to Imani Children's Home, the abandoned small babies. Yeah? They are referred by the government of Kenya through the paperwork of the government of Kenya. So if the government of Kenya thinks that children's home, private children's home should be scrapped off, they should at least show, even before they close them down, they should at least own up, have some responsibility towards what these private children's homes are doing, that we can see what they're saying they'll do. I don't think the government will manage it because, see, let me give an example about Imani Children's Home. Sorry to say this, but I like being blunt. Most of the government employees work because they are at work. It might not be necessarily their passion to look after children. So this guy comes today in the morning because it is his day to work, so he comes here, works, and goes home. He is detached from what he's doing. To take a case on point, Mom's example, all her life she has committed to this. Do you think the two people will still perform the same way?
Because if the government was now to take over this, they will not bear the same vision that Faith Imani had.
They will not, because one, whoever will be sent here as a worker. So she or he will be working for money, okay? But the other person, this is their passion. This is what they have been doing. This is what they live for. I think the difference speaks for itself.
So at the end of the day, we really need private children's homes.
Yes. What I would say, they need to regulate. Okay, they need to regulate because you see, again, not everyone has the good intentions. Some people may hide into charity to do other things. They need to have an eye on it, but closing them down, I hope if they do, which I highly doubt, they'll not give children the same services as these private children's homes.
Right. And earlier, Stephen, the mayor were alluding to other projects, even the whole, as you're mentioning, partnerships with Kenyatta National Hospital, bringing the babies here. Speak on that.
Sorry, we have this upcoming project. It's known as Safety Home for Mother and Child at Ngong. So this project is meant to be a safe house or an accommodation facility for patients who are seeking medical care at Kenyatta National Hospital, but they don't have relatives around Nairobi or within Nairobi who could accommodate them. Take a case sample of a patient who has come, maybe, let's say, from Wajir. They come to Nairobi for treatment. Right now we're doing the cancer center at Kenyatta. So this kid maybe is going for cycles of radio or chemotherapy for 2 weeks. Then after 2 weeks, there is a break. Then after 2 weeks, we found a gap that this patient, after the first session, they'll go back to Wajir and they'll never come back because maybe there is no fare. They know no one in Nairobi where they can stay. So this home is meant that Kenyatta will refer such patients and their guardians into our home. We will provide accommodation, food for free. And the next day, when their next appointment is due, then this patient will go now for his or her treatment from our home.
So, because I'd assume, even for this one, for Imani Children's, the services are free. Even for that one, as you say, the services are free. But at the end of the day, you definitely have to use money. So where mostly do you really get the donors?
Well wishers we have people who have pledged for things already. This project is, I'm the chairman of the project. I'm the one who doing the paperwork with Mr. Kadie, and I'm supposed to sign with Dr. Kamuri. It comes from well wishes. For example, we have Dr. Madenge, who donated a car or a vehicle already, which can pick now these patients from Kenyatta to Ngong. I'm chipping in one way or another. Another brother of mine is doing the same. It's entirely in-house projects that we are funding ourselves.
So even as the viewer, before we actually now get your last words, they're hearing this and they're wondering, okay, it actually sounds interesting. So how will all that work? From maybe, do they have to come to KNH first, and then from KNH they're actually told, by the way, you don't really have to go back? Or will they have this information before they leave their home area?
This is based on a referral system. A referral system means, you see, this patient belongs to Kenyatta National Hospital, and it's them to assess the need for this patient, because you see, we work in an extremely resource-constrained environment around this country. I'm sure you know of that. So if you were to say it's open for everyone, it will be prone to misuse and abuse. Now we want Kenyatta National Hospital to assess the need. And then if they find a genuine case that they think this patient will benefit from the accommodation facility at Imani, to so that the patient does not compromise on their treatment, then they refer that patient direct to us.
Right. Your parting shot on the future of Imani, well, until the time before, and if it is actually going to happen, before it is actually going to be scrapped off, the future of Imani, how does it look like for you?
The future of Imani is quite bright, and because it's something that's out of passion and goodwill to help those who are in need. As we speak, the Imani Alumni by ourselves, I've told you the project that we're doing. We are looking out now to helping other people as we were helped. Again, for example, most of us, now imagine that I came here at the age of 2. You find that maybe when I get children, some of them are named after Imani. So we are creating our own lineage.
I love that. Before actually even you wrap it up completely, any other more projects, even now from the alumni of Imani?
Yeah, we have a project that kicked back a few years back. It's down at the coast. We were doing Home for the Aged. We thought of people who have worked in such a setting as missionaries. Maybe you came here and you volunteered all your life, or you have been a worker here. So when that time comes, it would be so painful that all your life, all your youthful life, you spend helping other people, and then you're going out there and no one is out there to help you now. Now we have that project still in the process, whereby we want now to accommodate such people back, whereby now, because you helped, you also helped to the end of your days.
So definitely hope to see more of what Imani Children's Home will actually be out here. Asante sana, Daktari.
You're welcome.
For your answers. We definitely put a pause in this particular conversation, and just the whole, controversial bit of how private children's home, if they're going to be scrapped, and how the government should actually be the kind of, what should actually be done in such kind of scenario. We're taking a short break. We'll be right back. Right, we're going to take a short break, and from that particular place in Kayole, right in Nairobi County, Fred and Flora, it was, number one, it was an amazing bit, even for how that particular food was. I know same konanja. But anyway, the whole bit right now, 8 years from now, there are about 45,000 to 50,000 private children's homes. So it's going to be murky. Even speaking to the beneficiaries of this particular children's home, even calling for the government to regularize how private children's homes are. The clarion call for them is we really need, at the end of the day, we will need children's homes. But then we'll now have to see if we're going to reduce them or how this will really play out.
Interesting discussion.
Tutasa na hiyo chakula.
Yes, sort of.
Well, most definitely. Another important conversation, even on our question of the day this particular morning, even as we focus on matters universal health coverage, asking you, do you have any special healthcare challenges in your area that you feel like the government should be addressing? A whole hashtag that we're using even this entire week as we count down universal health coverage to be launched on Friday is Afya Nyumbani, and also hashtag Morning Cafe. Let's cross over to Kaptatet Stadium in Kericho County, where very own Sheila Chelengat is. Sheila, good morning. It is day 3 of this particular Universal Health Expo and conference. Okay, being told that we can wrap it up, but then remember our team is there for the whole wall-to-wall kind of coverage. We do have Sheila?
I think we'll be heading to Sheila shortly, but before that, we need to wrap up this show so that we can allow the team in Kericho to proceed with their continued special coverage of the UHC Mashujaa conference. So on behalf of the team that has been responsible for this show, thank you so much for keeping us company since 6 a.m. My name is Fred Ndimuli. Have a lovely day.
And I'm Flora Limuki. Do have a great Wednesday afternoon.
And I'm Yusduli Stanley Nyerungita. Have yourself a wonderful Wednesday. We meet right here at 9 p.m. for the marketplace with the backside. Goodbye. Right now, and actually, before we wrap it up completely, we can cross over to Sheila Chelengat. Sheila, even as we cross over to you, tell us the third day of this particular UHC Expo and conference. How has it started? What should we be expecting this particular day?